Each will control 20 minutes. The chair recognizes the gentleman from New Jersey.
And Mr. Speaker, I ask unanimous consent that all members may have 5 legislative days in which to revise and extend their remarks and include extraneous material on H.R. 951.
Without objection.
And Mr. Speaker, I yield myself such time as I may consume.
Gentleman's recognized.
Today, we're continuing our work to combat the maternal mortality and morbidity crisis facing our country. The legislation before us will help ensure that pregnant women and their healthcare providers are aware of the benefits and availability of safe and effective vaccines. Tragically, the Centers for Disease Control and Prevention reports that about 700 women die each year in the United States as a result of pregnancy or delivery complications. While there's no one cause of pregnancy-related death or health complications, we know that some illnesses like flu, pertussis, and COVID-19 can cause serious harm to pregnant women, including early labor and delivery and other complications. Vaccines prevent these illnesses and can save the lives of pregnant and postpartum women and their children. However, despite strong evidence of vaccine safety and efficacy, vaccine uptake amongst pregnant women is far below targeted goals. We can and should do more to increase the vaccination rate of pregnant women. H.R. 951, the Maternal Vaccination Act, will ensure that our vaccinations, outreach, and awareness campaigns and public health grant programs include outreach to obstetric healthcare providers as well as pregnant and postpartum women. The legislation will also ensure that we're reaching women from racial and ethnic groups and their children. And I urge all members to support this common-sense public health effort, and I reserve the balance of my time, Mr. Speaker.
Gentleman from New Jersey reserves. The gentleman from Kentucky is recognized.
Thank you, Mr. Speaker. Current data clearly suggests that vaccination... I'll yield myself as much time as I may consume.
Gentleman's recognized.
Thank you, Mr. Speaker. Current data clearly suggests that vaccinations for women during pregnancy can protect mothers and newborns against infectious diseases. The Centers for Disease Control and Prevention has long recommended various vaccinations for pregnant women to improve maternal and infant health outcomes. Despite these recommendations, vaccination rates remain low among pregnant women remain relatively low. But according to the American College for Obstetricians and Gynecologists, when a vaccine recommendation comes directly from a patient's own OBGYN, the likelihood of accepting that vaccine could be up to 50 times higher. The Maternal Vaccination Act requires the Secretary of Health and Human Services to include obstetric providers and existing vaccination public awareness campaign program to help women increase vaccinations among pregnant and postpartum women. Thank you, and I reserve the balance of my time. I have no further speakers prepared to close.
Gentleman from Kentucky reserves. The gentleman from New Jersey is recognized.
Mr. Speaker, I have no additional speakers either.
Gentleman reserves. The gentleman
I have no additional speakers, and I yield back.
Gentleman yields back. The gentleman from New Jersey.
And Mr. Speaker, I would urge support for this legislation, and I yield back.
Gentleman yields back the balance of his time. The question is, will the House suspend the rules and pass the bill, H.R. 951, as amended? Those in favor say aye. Those opposed, no. In the opinion of the chair, 2/3 being in the affirmative, the rules are suspended, the bill is passed, and without objection, the motion to reconsider is laid on the table.